times it's been hard. At times the funding has been less than ideal, but we have stuck together through this journey and really have some fantastic stories to tell about the transformation that we have achieved in Greater Manchester, which is down to all of you. On from where we started, it's an opportunity to celebrate all the fantastic things that you've done in practice, in place, in neighbourhoods, and over the whole Greater Manchester population. We started this process to make sure you had a voice in co-producing strategy and transformation, and actually strengthening the primary care provider voice in all of our 4 disciplines of dentistry, optometry, community pharmacy and general practice. And with that power, you've been able to transform things. You've been brave and courageous and stopped doing things that don't make good clinical sense or good sense for people's lives in populations that you serve. I'm just thrilled that we've had the opportunity to have one voice, to have one decision when it's important to have one decision, or to have 10 when 10 decisions are right due to place-based governance, and to have over 1,800 decisions when each organisation is important to make that decision. I've been proud to be part of this for the last 10 years, and hopefully you will see a celebration of all that we've done.
In Greater Manchester, primary care is more than just the first point of contact and the front door to the NHS. It's a strong, united force supporting better health for our residents and citizens. Established in 2015, the Primary Care Board provides a unified voice for primary care, including all 4 disciplines of primary care. This year, we're proud to celebrate our 10th anniversary, and I thank all my primary care colleagues for their hard work and commitment.
Our role is to ensure community pharmacies are a strong, connected voice in primary care across Greater Manchester. One of our biggest achievements this year has been giving pharmacies access to the GM Care record. Having that full picture of a patient's health means we can support independent prescribing, pharmacy first and other services much more effectively. It helps us to answer queries quickly, improve safety and provide truly personalised care. Looking ahead, we see real opportunities through the 10-year plan and Live Well approach to embed community pharmacy within neighbourhood teams. By linking pharmacy into the wider network of healthcare and community support, we can reach people earlier, help them stay well closer to home and make a lasting difference to the health and well-being of our communities.
Over the last 2-3 years, we've had an access quality screen, which has been a very successful operation done in conjunction with the commissioners, and it's allowed greater access to patients in the Greater Manchester area, and it's allowed practices to be able to see many more NHS patients they were seeing before. This ties in with what we're trying to do as an organisation, which is to help to serve our NHS dentists and allow them to keep providing the high quality treatment they've been doing for the last many years. We're working very collaboratively with them, and we're developing lots of different quality assurance schemes, which is helping them running those practices. And everything's looking very positive going forward, and we're really looking forward to a very bright future.
Over the last 12 months, together, we've been united and achieved so much and so many actions. One thing we're particularly proud of is the work within B Core. This has led to an extra £7 million being invested in general practice at a time when most other ICB budgets have at best been frozen and often been cut. We've done this in collaboration with our ICB colleagues, and the work of so many people in so many localities has driven a successful project to completion. This, if we now deliver it, will be proof of concept for why yet more and more investment into primary care in whole, and general practice in particular, is vital. The work we did on last year's scheme is already saving hundreds of lives. Let's do that together for the benefit of general practice and the benefits for our local residents.
It's been a wonderful year being involved in the Primary Care Provider Board. It's been great for optometry to raise its profile and work with colleagues across general practice, community pharmacy and dentistry to work with the ICB in meeting its strategy and its objectives and really engaging in the system in a collaborative way. Great example for us in optometry has been the hypertension case finding service this past year, and really implementing that at scale across Greater Manchester, supporting thousands of patients to have their blood pressure testing in optometry practices and identifying those patients who need to have treatment or diagnosis, and in some cases life-saving. So it's been a great opportunity for us to engage and work with colleagues across all of primary care to support the ambitions with the ICB. So lots of other examples of work that we have been doing, including our Optometry Excellence Programme and how we support the continuous drive to improve quality and support patients across our systems in Greater Manchester.
I work in the delivery team along with our programme managers and programme support officers. We have a really wide-ranging portfolio of over 50 schemes, as we call them. There are programmes and projects that we run on behalf of our discipline boards for all of primary care. It's really important that the programmes that we run have a positive impact on our frontline providers. So we work closely with the discipline boards to ensure that the offers and the support that we put out there for you meets the needs of our busy frontline teams. Some of the programmes that we've run in the past 12 months have been around leadership, quality improvement. We always have a CQC offer going to prepare frontline teams for inspection and to support them if post-inspection things haven't gone too well. We have a proactive care programme that helps PCNs to develop new models of care. We have a wellbeing leadership to help leaders improve the skills that they have to work with their team and to make the working environment better for everybody. We run a peer ambassador programme now, so we have 10 GPs across Greater Manchester, and we're supporting them by helping facilitate that network and giving them the tools to work in general practice, first-hand delivering transformation. So we've run over 50 schemes in the last 12 months, and we're hoping that you've been impacted positively by at least one of them. If there is anything that you think as a delivery team we can help you with, please do reach out to us. We're always keen to hear from our providers, and we want to support you in doing the job that we know you do really well.
We've been running a wellbeing leadership programme for over a year now. That's both looking at what we need to do together as the PCB team and also offering that leadership programme out to all providers. We know that all the research shows that there isn't anything at work that doesn't have the impact to affect our well-being. Being well at work is the outcome of getting everything else right.
Myself, along with some of our primary care network leads, attended the NHS Confederation Leadership Programme run by Primary Care Provider Board. And this was a really great opportunity to attend some face-to-face sessions run over 3 separate days, where we met like-minded PCNs and really understood the fact that we all have very similar challenges, but that there were a lot of collective solutions between us that we could bring back to our own networks. One of the things we took away that really supported our network was not just that management around conflict and relationships between practices, but really some of that strategic planning at PCN and how to develop key priorities over a year and mark ourselves against some objective measures to show whether we have or maybe not achieved some of that. I think overall the course has given me not just a lot of confidence as a leader within my primary care network, but it's really developed my leadership skills to think more about sort of system leadership.
So we undertook some board training in the summer of this year as we had some new members join the board. We had some of our board members who have been on the board for many years, had lots of experience and lots of knowledge, and we really wanted to try and level the playing field, make sure our newer members knew what the board was involved in and give them some confidence to make sure everybody was on the same page. So what we gained from this is that actually our newer members on the board did gain that little bit more confidence to speak up, and since undertaking the training we've noticed that our newer board members have been speaking more and contributing more in the meetings and have got more confidence to raise the hand and say, actually, I don't know what that acronym is you're talking about, or I'm not quite sure what this piece of work is meant to do, and it's allowed us to work much more interactively as a team.
I've taken part in the board development training programme this year. It has been a fantastic experience. It's been really helping me understand how our board as a collective can work a lot more effectively as a team, building that trust and shaping the vision that we share as a region. What I believe I've gained most is a better awareness of my approach and strengths and how to value the different working styles across our board. That's made a real difference in how we collaborate, how we tackle challenges together, and prioritise what matters most. And that's delivering outstanding, equitable care and improving patient outcomes for communities right across Greater Manchester. Thanks to the programme, I feel a lot more confident in contributing to board meetings, navigating complex issues and making sure that the optometry provider board's influence leads to positive system-wide change, not just within individual organisations.
I recently attended GP Excellence training on NHS pension for managers, and I found it incredibly valuable. It broke down what can be quite a complex topic into clear, practical guidance. The trainer explained not only how the pension scheme works, but also common issues managers face, such as handling contributions and understanding requirement options. The real gain was in practical examples and resources provided, which I now use to navigate the system. I left feeling far more confident in this area and much better equipped.
We took part in the Clear 2 CVD and Diabetes Proactive Care programme run from Greater Manchester in 2024. Honestly, overall, we have found it to be a tremendously positive experience for our PCN. The population benefited hugely. We were able to find time to take key clinicians in the organisation out through the training, made available the opportunity to offer think time, some space for clinicians and admin team and managerial staff to get together to run a programme. We found the population most benefited from was an increased uptake of our NHS Health Check programme and with a focus on CVD and diabetes.
Over the last year, we've achieved a great deal, leading on our excellence programmes for all primary care disciplines to support them to deliver excellent care. We've been supporting our teams with workforce development and well-being and creating new innovative models of care, such as the GP Proactive Care programme, the Community Pharmacy Minor Ailment Scheme, the Optometry's Urgent Eye Care and the Dental Quality Scheme. We are already working with wider partners to develop solutions and transformative care models to support left shift and prevention by building on our existing relationships in the heart of our local communities. This includes working as part of the Mayor's GM Live Well programme at Place. Primary care is already delivering great care in challenging circumstances, but we will continue to improve access to our services, ensure high quality, safety, and focus on improving the experience of our patients. Thanks so much.